Good afternoon. I'm George Latimer, Westchester County Executive. It is Thursday, January 14th, and we're here to give you the second of the two updates each week on the Westchester coronavirus update. This is month number 11 of the pandemic, and there's much to talk about today. I'm joined by Deputy County Executive Ken Jenkins, and the rest of our operations team and communications team all contribute to the information that I'm going to share with you. We're going to start with the COVID numbers today. We have been, and we will be discussing the vaccine distribution in a second, but as we have talked about the vaccine distribution as sort of the primary story here in the county of COVID, we've missed the fact that the COVID numbers have continued to rise at a rather dramatic rate. We are now officially 2 weeks since New Year's Eve, and so the various spikes that we expected for Thanksgiving, Christmas, and New Year's Eve have come to pass. We have at present 11,208 active cases. That is as many active cases as we had back in the peak period of April. Our max number of active cases was slightly over 12,000, so we're within 1,000 cases of where we were at our prior peak in the spring, in the late winter, early spring of 2020. That's a concerning factor, 11,208 individuals. That's on the basis of 80,869 people that have had COVID in Westchester County. Keep in mind there's 1 million people in Westchester County, so as that number rises, as we approach the 100,000 mark, we would be at a point of 10%. This is 8% of our population that at some point in time has received the COVID virus, and 69,661 have cleared protocol, so that gives us the 11,208 individuals as of today that are considered active. That 11,200 number compares a week ago to 10,039, 2 weeks ago 8,550, and 3 weeks ago 8,142. So you can see the increase, and I would argue you can see the increase, and we don't know exactly how to parse it out, but part of the increase is holiday season, and part of the increase now, we believe, is the more communicable version, mutation, if you will, of the virus, which we've heard a lot about, originally in England, but it's elsewhere now, in the United States certainly. And we're seeing many more positive cases. We had 723 positive cases to COVID from yesterday into today. And just to give you a parameter, if you go back to the period of time just before Christmas, which would be not quite a month ago, we had 577 cases on the same evening. The week before that, 571 cases, and that gives you an idea of how much the infection has jumped up. We have issued 1,571,910 tests so far, and of course that's in excess of the number of people in the county by 500,000, so that clearly signifies multiple testing now for people. I myself have been tested twice, and many people have been tested many more times than that, but we have pretty much reached a very wide quadrant of people in Westchester County that have been tested for COVID. The last hospitalization number we have is as of Tuesday, 554 people have been hospital or are hospitalized for COVID. That number does change every day. It can jump up or down by multiples of 10, but at 554, that is the highest number that we have had in what we would call this the second peak of COVID. In our first peak in the spring, we had as many as 1,200 people hospitalized. So 554 is approaching the halfway point of what our peak hospitalization was before. It references, in essence, about 5% of the people that have COVID are hospitalized for COVID in this particular moment. That percentage was higher in the beginning of the infection, but it's still a significant number. But at 554 individuals, it does not yet reach the maximum number of hospital rooms in the county, which is what you're seeing in other parts of the country. Certainly Los Angeles County in California, parts of Arizona now are seeing this. And then there may be other parts of the country in more rural sections where the local hospital bed capacity and ICU bed capacity is being exceeded by the number of hospitalizations. Right now, 554, that number is as of 2 days ago. The fatality number aggregate to today is 1,763 people. That is 52 people in the last week and 100 people in the last 2 weeks. 2 weeks ago was New Year's Eve Day, December 31st, going into January 1st. From that date to this date, we have lost 100 people. And that is a serious loss, a serious fatality number. The concerns that we have over the increase of infection, the increase in hospitalization, and the increase in fatalities is that we are not talking about that we are in the process of becoming inured to these numbers when every one of these people have died as a human being. We made that point when we had our ribbons of remembrance out in Lenoir Preserve. It now has its winter residence here inside the county office building at 148 Martine Avenue, where we still give you the opportunity to recognize those people in your lives who've been lost to COVID. And this loss of life is continual. And last night we lost 11 people, and that's a lot to lose in a domestic setting without some type of specific tragedy. This is the continuing tragedy of COVID that we are not yet past. We look at, the traditional, we say it every time, such a cliche already, the light at the end of the tunnel. And the way I phrase it is there is a light at the end of the tunnel through vaccines, but we are still in the tunnel, and we're very much in the tunnel when the numbers rise. So if I leave one impression with you on the numbers today, the numbers continue to rise. Even with the presence of a vaccine that is starting to be disseminated, we have increased infection, increased hospitalization, and increased fatality in Westchester County. And I don't think we're alone, although we track the numbers that are germane to Westchester. From the standpoint of the vaccine situation, we have had vaccine available now over a couple of weeks' period of time, but really this week, this Monday, was the first time that it was opened up to a larger cohort of people outside of very targeted groups. In the beginning, when the vaccine was distributed, it was distributed solely to healthcare professionals who have patient contact, EMS individuals who are in contact with patients as they bring them to medical facilities or apply treatment to them in an on-site situation, nursing home staff and nursing home residents, and a couple of other categories of medical professionals besides doctors and nurses, dentists, and a host of other different therapists. That was a narrow band of individuals that were able to get the vaccine, and those were distributed to the extent that those people came for appointments. We have now expanded to a much larger universe. It expanded as of Tuesday to all those aged 65 and older. We were originally expanding it on Monday to 75 and older. The CDC changed their protocol within the next 24 hours. New York State changed their protocol, and now people 65 years of age and older, and those that have certain medical issues, medical histories, are also eligible. The best way to determine if you are eligible for this is to go onto the New York State website, where they lay out what those specifics are, and then you can make the determination if you are one of those individuals. If you have a family doctor or a medical practice that you go to, consult your medical professional so that you can understand if you qualify under the state's regulations. The state, however, has established this program, and I can't emphasize this enough. This is not a blame game. This is to help you understand who the decision makers are. Because when I watch the chat room, even as this presentation goes on, I consistently see people saying, you should have done this, you should have. Those decisions aren't mine to make. They aren't ours to make. I'm perfectly happy. If you give me the authority, I'll make the decisions. But if I don't have the authority, I have no more authority over the state government establishing these provisions than I have over the federal government, who establishes the amount of doses that go to New York State. So we need to be practical about where do you want to express your point of view. If it falls within the state's administration of something, then the state governor has that authority. And as we talk about some of the updates today, you'll see that the state has changed a policy here, and they've changed other policies over time. So lobbying has its effect, but you have to know the right place to go because of who makes that decision. And sometimes when I see comments, in the area beneath this video, if I find them to be unfair comments, I push back on them, because this is if there's ever a time to talk truth, this is that time. And truth sometimes is inconvenient. It's not what you think it should be, or it's not what you think it is. It doesn't matter what you think. It matters what is objective truth. And in this case, the state has structured a program, and we're now trying to help administer it so that we can get as many people vaccinated and as many people protected from the disease, ultimately with the mission of going back to the society as we remember it on or about February 29th a year ago. And that is our mission. Everything else is subordinate to that. It's not about anything else other than that. So with that thought in mind, Westchester County has long since given up the county center, which is a county facility, given it over to the state, and the state of New York is now operating it as a vaccination center. County staff is assisting in that process. We are partners. We do not make the decisions as to who is eligible. We do not set up the website that you call into, but we have people over there to help administer the process to try to move along the situation. And yesterday was the first full day of operations for Westchester County Center as a vaccination center, and I'm happy to say that 1,030 people were vaccinated yesterday at the county center. Now, 1,000 people in a county of 1 million people is a small percentage, but this is, a hopeful sign that we're heading in the right direction. 1,000 plus vaccines have been given directly by the Westchester County Department of Health. We have operated at the facility that we have here in downtown White Plains on Court Street, our clinic, and we have been giving out vaccines now over the last period of time targeted to those individuals who were in the 1A category that I just alluded to before. Those were EMS and those who were medical care workers, those working with inside and outside the government structure. So from that environment, we have given over 1,000 vaccines out, and the state program that's over at the county center has a separate 1,030 people that have been given vaccines. We have at our clinic 230 people scheduled for today at the clinic in downtown White Plains, and we hope to hit that 1,000-person number every day that we're open at the county center. And we will operate that facility from 8 a.m. in the morning until 7 p.m. in the evening. When you go, if you have an appointment, we'll talk about that process again in a second, you can park in the parking lot that is on the east side of the Bronx River Parkway. As you come south from the northern area, you make the left turn across. If you're coming north up the Bronx River Parkway, you make a right turn. That large parking lot, you show them your appointment. You show them that you have a sheet that says you're going to go for a test, for a vaccine today. You show that to them, you will park free. And then, of course, depending on the available spaces, you'll park as close as you can and walk into the facility. As we have individuals that have some compromise issues, we'll try to be helpful in transportation needs for them. But for right now, as you're coming on your own, our advice is always travel with somebody else. And we'll talk a little bit more about that process. But in terms of total vaccines, 2 separate locations, County Center, 1,030 in one day, month to date, few weeks to date, at the healthcare clinic in White Plains, separate facility, 1,015. Now, the Westchester County Center vaccination area is by appointment only. Do not drive to the county center, go inside, and seek to get a vaccine. The vaccines are not being issued on a first-come, first-served basis. That is structured from the state, and in fairness to the state, we're going to talk about this in a second, there is nowhere near enough vaccine product being released by the federal government to this state or any state that allows for a first-come, first-served program. So the state, and I think wisely, has targeted different constituencies to receive it first before the general population does. Common sense will tell you the older you are, the more vulnerable you are, they should get the shots first. Common sense tells you that medical professionals, police, fire, all eligible to get the shots. People who are in public service jobs that affect directly public, people who drive buses or operate mass transit facilities, we need those people healthy doing the things that they do professionally. So there is a sequence of events for those who are at a certain age, a certain level of health. They want the vaccine, I understand that, but we want to try to get people who are in greater need to have the vaccine first. That's why the state has set up this system of targeting it. So do not walk up to the county center without an appointment, and you only get the appointment online. That's important to understand. Now, there are hospitals that have various abilities to give out vaccine, and there are some pharmacies that can give out vaccine. Those are authorized by the state of New York. They are not under the control of the county government. County government controls the clinic on Court Street, and we assist at the county center. Those are the 2 places where the county government has responsibility. Somebody comes up to me and says, I was in such and such a community and I couldn't get vaccine from my local pharmacy. What are you going to do about it? I am going to report that information to the state so that folks who are making the decisions in the state about who gets the vaccine and so forth will be able to know that. But that is not something that we have direct control over. And I say that just so you don't have expectations that when they're not met, you have a misdirection of whatever your concern or your anger might be. If you come without an appointment, you will be turned away. You will not be turned away because people are mean. You will not be turned away for any reason other than the state intends for you to register online before you get a shot. And you have to fit certain criteria to be eligible to get that shot as it stands now. We want everybody to be vaccinated. If we knew that we had the proper supply of vaccines, then we would open the door, first come, first serve, to everybody, knowing that we have sufficient amount of vaccine. But we do not have sufficient vaccine, not in Westchester, not in New York State. I want you to understand this very clearly. This is a fact. This is not an opinion. You can't take this fact and turn it into something else because you want it to be something else. The federal government releases to each state a certain allocation of vaccine. It's produced in the private sector, but the federal government is, to the greater extent paying for the cost of this. You do not pay for this shot. We do not pay for the shot as a county government. So the federal government has determined that they're going to parcel out the vaccines based on a formula that they have, population and other factors. We're not really sure what that formula is. My understanding is, as of today, New York State, the state of New York, receives 300,000 doses of vaccine each week. 300,000. Now, do a little math. There's 19 million people in New York State. If we were only going to get 300,000 doses a week, it would take you over 60 weeks, which is more than a year, to vaccinate every man, woman, and child in New York State. That number of 300,000 has to rise. That has to rise up to a number efficient to have New Yorkers vaccinated. And I might add, X million people in Connecticut, X million people in New Jersey, 54 million in California, X number of million in Illinois and Ohio and Florida. There's a nationwide requirement to provide vaccine. This is why we have argued that the whole dealing of the COVID virus should have been done with national policy in mind. But it wasn't done that way. So now we'll deal with it until and unless it changes. New administration coming in a week, and we'll see how long it'll take for them to exert their direction on this. If there's a different change in policy, we'll certainly share it with you. But at this stage of the game, 300,000 doses come to New York State a week. Westchester County, you can do the math, is about 5% of the population of New York, in round numbers. A little more than that, 19 million New Yorkers, about 1 million Westchester people. If you parcel it out based on population, Westchester County would get 15,000 doses a week. And the demand in this county for vaccination far exceeds 15,000 people for this present moment. So when people come to me and they say, hey, I have to wait until March, I have to wait until mid-February, the lack of supply is why. There's not enough supply to meet the demand. That is something fundamental. We all heard it in school. If you've been in business, you know it. Supply, demand. The lower the supply, the higher the demand, the more precious the product is. When there's low demand and high supply, there's a surplus, and that's where you get discounting. That's when people who have a product, they start selling it to you on the cheap because they want you to come in. When I was a little boy, I remember being in a car with my dad. He would pull in to gas up the car, get a full tank of gas. I don't think it was $20. Might have been $20, might have been $30. You'd get a cup, and 4 guys would come out and wash all the windows on the car because the demand was not as high for oil, which was cheap in those days. And then in my adult lifetime, 40 years ago, I had to stand online with an even or an odd license plate. This is ancient history to some of you. This is something we remember for those of you who were around because the supply was very low and the demand was very high. That's what we're dealing with now. High demand, low supply, and so it's precious to get an appointment. And when you call and you can't get it, it's not the incompetence of people. It is the lack of supply to be able to guarantee you the appointment so that when you go, that the supply will be there. And I hope you understand that as common sense practicalities. And once again, I understand this political climate of ours. We take an apple and call it a banana. And if 57% of the people think it's a banana, we call an apple a banana. But it's still an apple. And supply and demand still governs these things. From the standpoint of the federal government, we hope that with the new administration, there will be a different mindset. We hope there'll be a solid focus on this issue. This is the number one issue in America today as a policy issue. We've created a new number one issue, but I'll leave that for other conversations about the federal government. My job is to talk about the county government here today. And our number one issue is to deal with COVID. We cannot deal with all of the other problems of county government or the county. We cannot build the affordable housing we want. We cannot make improvements in the infrastructure of our county unless we get our economy back to normal, unless people go back out into the society and consume products as they had previously to generate the wealth. People who have businesses start to have profit. They hire people. People are hired. They have money. They spend that money, and the economy grows. We cannot get back to that until we get rid of this. And we don't get rid of this until enough people are vaccinated and so they don't fear getting the disease. Many people who fear getting the disease will not go into a grocery store, will not go into a retail store, will not go out to eat, will not get on a mass transit train into New York City. And all of those different things affect the ability of a government or any business, any entity to function. That's common sense. There's nothing ideological about what I've just said. So fighting the COVID is number one. And right now we have, after long waiting, the tool that we've needed, which is the vaccine. So getting the vaccine out becomes to how much can be produced. That's a production issue. How much the federal government, in incentivizing the production of it, can disseminate it out to the communities and to the states first, and then down to the communities, and then how fast we can get this in people's arms here in Westchester County. We are trying our best to do that, and now that the county center is open, we think we're going to be able to do a solid 1,000 people a day, and we think that's going to be very helpful. I repeat again what we already know, and I believe we have graphics on the screen that will highlight this. We are in phase 1A and 1B. There have been some changes in terms of eligibility, but there's a certain fluidity. So until you have your appointment and you're happy with the appointment you have, you should check online to the health care website, the health department website for New York State, and you can determine eligibility from a website that starts out with "Am I eligible COVID-19 vaccine?" If you are looking at the actions that you can take, there's a website by which you get the form necessary to fill out for COVID-19 application. You fill that form out. It will open the door for you to be able to look at sites where you can make your appointment. And there is a hotline established as well to call. When demand is high, hotlines get jammed up in a hurry. When demand is high, websites crash, our vernacular word. They may not actually crash, they just become inoperative until they can handle the amount of traffic that's coming. Those different issues are critical. You should make note of it. Where you go online to start the application process, where do you call if you have questions or problems, and where you go online to find out if you're eligible, so you start the process when you're in a cohort that is eligible to get the vaccine disseminated. So with that, there's a couple of other topics that I want to make sure that we cover as we go through all of this. There are lots of things that are COVID-related, triggered in the society. One of them deals with how we are educating our children. And it's a very difficult process right now, because when you cannot have all of the children in classroom, you cannot have the best possible learning environment. You know, we structure our public education with in-class expectations of education, but the advance of this disease, this contagion, makes it difficult to do the traditional. So we are trying to do some things that get us through the immediate period of time that we're in, and one of them is to try to deal with remote learning sites. And we hope that that will be helpful in terms of getting us through this period. It's a very difficult year for children. It's a very difficult year for educators. We will try to get through that. Ken Jenkins is going to cover remote learning sites here in Westchester County. Ken.
Thanks, County Executive. As the County Executive mentioned, as we continue to watch both the number of cases rise in Westchester County and combine that with the vaccination process as it starts to kick off and starts to get there, it is critically important at this time to make sure that we had education and making sure that the hybrid learning, and we were able to support that. last year, we were able to utilize some COVID dollars and CARES Act money to be able to open up 16 remote learning centers throughout Westchester County. Those remote learning centers helped support the individual children and their families, not just youngsters that are at the elementary school age, but also those younger folks that needed some additional support during the remote learning process. They had computers available, they had additional support available, and it worked extremely well in those 16 locations. Of course, that ended at the end of 2020 on December 31st, and based on County Executive Latimer's direction, we were able to restart those because of the demand, because we need to continue that with those first 2 weeks that were pointed out from the New Year's holiday and the holidays, the Christmas holidays and Hanukkah and all those things. And now we are restarting those programs. Those programs are starting up on January 19th. Some of them may have already started. It was a very, very critical and important service for those families because it's hard to be able, and people already realize how challenging it was to be able to do your work from home, make sure that you were doing the hybrid instruction with the young folks. Getting online was a challenge to many people, and these remote learning centers help to do that. So we are starting those back up on January 19th for all of those individuals. That's next week. On Monday, we'll be kicking those off again, and we're going to continue those throughout the school year because, as County Executive said, if you just do the straight math on the vaccinations, we will not be in a place where we have the quote-unquote herd immunity until very later on this year. We're all hopeful that we get more vaccinations out, as County Executive pointed out, but it does not look like that will happen until early in the fall if we are able to continue on this particular pace. For information regarding the remote learning centers, please contact Director of Policy and Programs, Child Care, Education, Rosie Finizio. And her number is on the screen at 914-995-2501. Once again, 995-2501, or rfinizio, Finizio, at westchestergov.com. And we should all continue to remember the vaccinations, as County Executive Latimer pointed out, they are not a passport, right? We need to continue to do all the things that we've continued to do to get us to this particular point. We need to stay New York tough, as the governor would say, but we also need to stay smart and making sure that we're protecting each other. We still got to mask up. We still have to make sure to maintain social distance, and we certainly need to continue to wash our hands. Thanks a lot.
Thank you, Ken, and thank you specifically to Rosie Finizio, Director of Policy and Program, that's working on this project. We have a number of terrific people, one of whom I'm going to mention in a second, that have really done yeoman's work here during COVID. And it's hard to see when you're looking at it from the standpoint of your own personal needs. If you don't fall into the category of needing learning for your children, you don't realize that we still have to provide that. In the same way we have to provide some effort for food, to deal with food insecurity and a host of other issues that fall into this category. We have good news today for residents of the Village of Portchester and restaurateurs in the Village of Portchester. The governor has announced today that in light of a lawsuit that is pending in Erie County that affects an area of Erie County, that he is now making a change in the policies for restaurants that fall in communities that are in orange zone designations and applying the less stringent regulations that apply in the yellow zones of the format that was put out. In Westchester County, there are 6 zones that were created by the governor and his team. This dates back over a month ago. The remaining other locations are all yellow zones, but Portchester was designated as an orange zone. In the orange zone, by the original outlay of information, there was to be no indoor dining. There was permissible outdoor dining and, of course, takeout. However, as we have entered into the winter periods in November, December, and now January, it is simply too cold to have appropriate outdoor dining. So functionally, orange zone restrictions have closed all restaurants, and that is what's happened in the Village of Portchester, which is the only community in Westchester County subject to this. There are other orange zones designated around the state. Obviously, the ones in Erie County were the ones that were sued. The court case has not been adjudicated, But in the meantime, the state is rolling back those restrictions, so it is now going to be less restrictive, and restaurants that were forced to close in Portchester now will be able to open under some additional criteria. I want to say that this action taken by the governor is welcomed, and it has been advocated for quite a while by those of us in public office. And I want to state clearly for any of you who may be watching who live or work in the village of Portchester, this is the decision of the governor, but it is also the hard advocacy work of Mayor Fritz Falanka and members of the village board. This was the advocacy of County Legislator Nancy Barr, of State Assemblyman Steve Otis, of State Senator Shelley Mayer, and myself and my team as County Executive. All of us were of one voice that we felt that the standards of orange zone closure of restaurants was too rigorous a standard, and not to just end all standards, but to make it the more practical standards of the yellow zone, which does allow for these restaurants to open under certain requirements and situations. I myself had a couple of stops that I had to make today, and when I went to those stops, I had a temperature check at each stop, and that is perfectly acceptable to me. If I were running a fever, I would be prohibited from entering wherever I might be, and to me that seems like a plausible type of requirement, not you can't go in the place at all. So I'm very happy to announce, it's already been announced earlier today on the statewide announcements, but I'm happy to reinforce that announcement today, that the yellow zone restrictions on restaurants, the less restrictive issue, will be at hand in Portchester, I guess beginning immediately. And of course, Portchester is a great restaurant town. There's a lot of wonderful restaurant towns around Westchester County. Portchester is certainly one of them, and we hope this helps some of those restaurateurs get back on their feet. A similar announcement goes with it. Tomorrow, I'm going to be with Mayor Tom Roach of White Plains as White Plains launches through its Business Improvement District its first ever restaurant month in White Plains. We're going to be advocating some of the restaurants in White Plains under the proper restrictions, social distancing, wearing of masks, making sure that all of the different protocols are followed. You'll see in many restaurants now plexiglass dividers that separate a booth from another booth, whatever that process is. But I'm happy to stand with Mayor Tom Roach and the White Plains bid. The restaurants all over Westchester County are struggling. The ones in Portchester had a particularly severe situation, but they all are. And many of the people that are hired by restaurants are those that are working from paycheck to paycheck. They need to be able to work the hours. They need to be able to make the tips to survive for their families. So more than 20 White Plains restaurants will be offering specials. They'll be highlighting their particular type of cuisine, and there's lots of different great restaurants, ethnic cuisine in White Plains. You can get a list of participating restaurants by going to the website. I believe it's up on the board here, www.wpbid, White Plains bid, wpbid.com/restaurant month. And we'll have that tomorrow to be part of the press actions in the month. I want to go back to Portchester to recognize a Portchester resident who's been a part of our team for the 3+ years that we've been in office, Blanca Lopez. Blanca joined us as a Director of Program and Policy. She has worked very closely on issues of housing. She has been the key liaison in our police reform task force efforts and issues. She's been involved in all of the criminal justice areas of correction and probation departments, and she has done a magnificent job. And she has now been promoted to the position of Assistant Director of Operations for Westchester County. She will report directly in the line of authority, Joan McDonald, Director of Operations, Deputy Director of Operations, Emily Saltzman, Assistant Director of Operations, Blanca Lopez. And that is for the operation of the whole county. Every operating department reports to that key operating team. Blanca has proven herself. We recruited her from her outstanding work with HDSW, Human Development Center of Westchester, which operates a variety of programs, Hope House and various group homes and so forth. She has been active in the Portchester Rybrook Kiwanis Club. She served as president there. She was a member of the Portchester School Board, served as president there, active in a number of organizations, community-minded. I think she's a PTA president this year for one of the schools where one of her children goes to in the Portchester School District. And what a tough year to be a parent, much less a PTA leader. But Blanca has shown her leadership in every way. We want to compliment her, thank her for her service. Now she has additional responsibilities, which we're confident that she's going to perform well. Over the last few weeks, you've seen us make a number of announcements. of promotions and new hires. And I just want to highlight that we're trying to highlight people so that you see the quality and the diversity of what is the leadership of Westchester County's government. There's any number of different people who bring skills to the table. In the last couple of days, we just 2 days ago, we were at the Department of Correction and showed that we were appointing a promotion, new first deputy commissioner, Nori Padilla, that we were adding a deputy commissioner, Reverend Michael Gerald, and then the existing team, Deputy Commissioner Leandro Diaz, under the leadership of Commissioner Joe Spano. That's 2 of the 4 top people in Department of Corrections who are new and dynamic and bring different life experiences to the table. We've announced already that Lisa Reyes will be joining this communications team. And you know Lisa very well from her work on News 12. She was a nightly presence on our TV screens as we got our updated local information from News 12. And we're very happy that she's joining our communications team. We have Chris Steers, who we're going to more formally introduce in a couple of weeks, but he's been with us now for almost 2 months. He's been one of the key people operating in the setup of the county center facility that we've just mentioned. And Chris is a former village manager in the village of Portchester, has other experience in government from the state of Florida, where he was before he came to Portchester. And we're very happy to have him on board. And we're going to be announcing some other appointments and some other promotions over the few days. Just so you understand, you see the face of Westchester County. Ken Jenkins and myself are the ones that are on camera all the time. And I understand that you can make presumptions based on the faces you see when there are faces that you don't see. So we're going to make sure you see all the faces of Westchester County, the quality of people that we have in our health department. You got a little taste of that with Dr. Charlita Amler and Dr. Dial Hewlett, and there are other doctors, Dr. Wang and others that we want to make sure we introduce to you. So you see the diversity and the talent that exists in Westchester County. But for today's purposes, Blanca Lopez has done an outstanding job with us. We're very proud of her. She takes on new responsibilities because she has earned it, and she's earned it the old-fashioned way by working hard and achieving. I want to cover one more topic. I think I have one more topic left, and that's the one that's really been generated by the incidents of Washington, D.C. last week and before, which is the matter of safety. Let me say, first of all, that we recognize that there are things happening in the nation. Westchester County is not inured to those things. We don't see them happening someplace else. They can happen anywhere at any point in time. I think we do understand that we're in a highly politically charged environment, but we also deal with the fact that we are a free and open country. We pride ourselves in our freedom. We come and go in ways that you don't have the opportunity to do in totalitarian countries where every movement is monitored and has to be approved by some authority. And because we have that freedom of movement, we are more vulnerable to people who wish to do violence to us because we are an open society. So the very things that make us proud of our society become the tools that could be used against us by those that would subjugate us into doing their will by means of force. And whenever a group of people come into a legislative body to threaten those who are in the body duly elected, they are trying to say, we know whatever your authority is, we want you to do what we want you to do, and we threaten you. And the threat is not only in the legislative institution or in the seat of power, the offices that you work in, it's wherever we may see you in public. We want you to be afraid. We want you to be afraid so that you will do what we want you to do, and it doesn't matter if we win at the ballot box. We intend to intimidate you. And in the extreme, we intend to not worry about ballots, we'll worry about bullets. That is the fear that is let loose when you see mobs act the way that they did last week in Washington, D.C. So I want to assure you that our county police, our Westchester County Police, are working with all of the different police organizations, the state police, the federal FBI, and other agencies to try to identify any threats to the public safety, not just to the public safety of public officials, but the public safety at large, and identify those threats and address those threats as early as is possible. We do not take it lightly. Working with the FBI Joint Terrorist Task Force, our professionals and their professionals together will identify different strategies that we can pursue. There's an active dialogue going on in the Board of Legislators and here in the executive branch to what do we have to do to protect the people that work for Westchester County. And we owe an obligation to protect those individuals. They're here doing public service. And for those who are watching who have disagreement with policy, who have disagreement with even the principles of what government should or shouldn't do, those are legitimate public policies to debate peacefully amongst free adults, but not to try to influence with threats. And we simply won't accept it. We just won't accept it. I don't need to yell or pound the table. We won't accept it. We won't not accept it. We expect there to be freedom and the ability to move freely in the society and without fear of violence. And our safety is paramount. All of our additional police patrols will be available out there, and obviously the county police, but the county police working in concert with all of the local police departments. We have roughly 40 of them out there. We have great respect for our police services. We know that we have the backup of the state if we need it, and we will consult and work together to try to make sure that we protect your safety as best as possible. Nobody can anticipate what might happen in the future, but we should not be afraid. It's the same message I've delivered in terms of COVID. The world is an unsure place. No one can predict what will happen tomorrow. No one can predict how long they're going to live. No one can predict whether they will have good fortune or misfortune in the days to come. But we've moved forward as a country with a certain sense of confidence, and we have confidence in each other and in ourselves. And I apply the same principles to protecting our public safety here in Westchester County as I do for each of us as individuals. We had a series of social justice rallies during the spring, 40 of them in the county. Not one of them turned into violence. Not one of them turned into looting. And that's the standard that we uphold. And by the way, there were political rallies and caravans that went around the county in November. And there were no violence, and there was no looting, there was no personal assaults on individuals. That's the standard that we expect in Westchester County. We expect everyone to have free speech, where appropriate, with proper approval, free assembly, but we expect them to be peaceful. And we will meet force with force, and we will respect everybody's opinion because we're inclusive. We open our arms to every point of view, but not to violence. With that, I'll see if there are any questions that we have from the press. No questions from the press? Very good. Then if there are members of the press who have any questions, by all means, direct them to Catherine Chaffee, and we'll be happy to follow up accordingly. Our next briefing will be next Tuesday, I gather. Monday is a federal holiday, the day for the Reverend Dr. Martin Luther King. There will be a number of different events, many on Zoom. Volunteer New York is sponsoring a series of volunteer activities that day. Go onto their website, spell out the words, volunteernewyork.org, I believe it is, and you will be able to find a way on Martin Luther King Day, if you're free, that you can be involved in a program to help individuals. There's food distribution going on at food pantries, there's clothing drives, there's an ability for you to help mask distribution for those that could use it. There's any number of ways you can spend part of that day if you have the day off. And if you are working that day because you're providing an essential service, then thank you for working even when others are off on a holiday, because all of these things represent this common vision of us as Americans. Since we won't meet again until after the celebration of Dr. King's life, let me highlight that is really what is at hand, that we celebrate the life of Dr. King and what he stood for. And he said many wonderful things over his career. He gave many sermons and speeches that are all memorable, from the speech on the Mall, the I Have a Dream speech, often quoted, the speech he gave on the last night of his life before he was assassinated, the Up Into the Mountaintop speech. But he said something that has always stayed in my mind, and I think it probably should be the motto for all of us, that you judge a person not by the color of their skin, but by the content of their character. May we all judge each other by the content of our character, and not by our gender, not by our sexual identity, not by our religion, not by our age, not by any other factor other than the content of our character. If we do that, that would be the best way to honor Dr. King and to honor this weekend, and for us to get through this moment that we're in and to go forward together as Americans. I'm George Latimer, County Executive. Thanks for watching. We'll see you on Tuesday for the next update. If we have anything to report that's more urgent, we'll break back in and we'll inform you so much. Be safe. Have a good weekend. We'll see you on Tuesday.